Well, hi and welcome everyone. We are here to talk about the OER Nursing Essentials Project. So it is a collaboration between the Texas Higher Education Coordinating Board and OpenStax. We claim them because they're out of Rice University in Texas. So, and we love to collaborate with them because they're lovely people and also very good at what they do. So I'm Kyla Torrey. I'm Senior Director of Digital Learning at the Coordinating Board, and I guess I will ask my other two presenters to also introduce themselves before we get started. Anthony, you want to go first?
Okay, I'm Anthony Palmiotto. I'm the Director of Higher Education, OpenStax. Thank you all for joining. Great to be here with you all. Carrie?
Good afternoon, everyone. Hope you're enjoying your first day of the conference. I'm Carrie Gits, and I am a director in the Division of Digital Learning at the Texas Higher Education Coordinating Board.
All right. Well, let's do a little overview of what we're going to get into today. I think that's on the next slide. And we have introduced ourselves. So we're going to give a highlight of the what we call the O.N.E project, the OER Nursing Essentials project, give some background on how it came to be, some insight on how we worked collaboratively with nursing faculty, administrators to develop the textbooks and go through the peer review process, and then share some opportunities for learning more, talk about what's next, how to adopt the resources, when they will be available, and all of that good stuff. And then our learning outcomes for today are to develop and expand awareness of the O.N.E project and the resources that will come out of it, to really understand the whole background of the project. It's been sort of a long intricate dance to get to where we are today, in the creation of these resources, to look at the value of the collaboration across organizations, agencies, and institutions that really helped us build this OER, and then to develop or to identify the opportunities for adoption and use of the resources when they are released in early 2024. I'm first gonna just introduce the Texas Higher Education Coordinating Board a little bit, because if you're not in Texas, you might not have any idea who we are. So we are the state agency that was created by the Texas legislature to represent the highest authority in matters of public higher education in the state. So we oversee the universities and community colleges, both public and private. And it's really our mission to be a resource and partner and advocate for the institutions, and ultimately for the students in higher education in Texas, to help result in a globally competitive workforce. The agency is structured such that we have a board that is appointed by the governor. There are 9 members of the board and 1 student member. The board hires the commissioner. Dr. Harrison Keller is our current commissioner of higher education in Texas. And then the agency staff, which includes Carrie and I, oversee all of the programs and policies that the agency puts into effect. And we have a variety of functions at the coordinating board. So we do things like approval of new schools and approval of new programs. We have a financial aid program for Texas students. We are in charge of sort of all of the data we collaborate with the Texas Education Agency, which is our K-12 agency, and also the Texas Workforce Commission, to sort of have a broad view of students as they go through K-20 and into the workforce. And we have centers of work at the agency, which include student success, college and career advising, workforce education, and digital learning, which is where Carrie and I fall. And we also work on policy matters, including our strategic plan for higher education, which is called Building a Talent Strong Texas. And we work with the legislature to think about policy for higher education, and of course provide advice and counsel as much as we can to our stakeholders in higher education. The Division of Digital Learning is part of the coordinating board, and that's where Carrie and I fall. We're a relatively new division. We were established in November of 2020, which was a pretty good time to have a Division of Digital Learning. And we have the mission of providing leadership and advocacy for digital learning in higher education and promoting, sustaining, and advancing a quality digital learner experience for all students. We're a small but mighty team of 8 now. Our founding assistant commissioner is Dr. Michelle Singh. Amy Zandi, our administrative assistant. I am senior director. We have Carrie is one of our directors, along with Elena Cantubi and Gwendolyn Morel. And our program directors, Marianne Maddox and Elizabeth Tolman. And you'll see along the bottom there the core values that we developed collaboratively as a division that we try to take into all of the work that we do. Our goals as a division really are to advocate for, build capacity for, and recognize digital excellence in Texas. And so we have a variety of programs, many of which are focused around OER and open education. And the O.N.E project is one of those that we will talk about today. So I'll hand it over to Anthony to talk about or to introduce OpenStax.
Thank you so much. OpenStax is a part of RICE. We are mostly known for producing open educational resources, typically in the form of textbooks. We do a few other things, related to those, workshops, supporting faculty in using those textbooks and other resources. And also, we really work to try to help people use OER in general, whether it's ours or other people's. Thinking about how our practices and procedures can be applied in other situations, and also, of course, improved upon. We consider ourselves a member of this great OER community that's at this conference and beyond it, and we always like to take part in that. And the THACB has been a wonderful supporter of ours and a great partner, but both in Texas and and beyond, because the resources we're going to be talking about today can actually be used outside of Texas as well.
Thank you, Kyla and Anthony. I'll just talk a little bit about some of the OER initiatives, and we'll lead into the discussion of the project, the O.N.E project. But as Kyla mentioned, in the Division of Digital Learning, we have a broad portfolio that through collaboration and partnership with stakeholders in Texas, our division leads programs supporting OER and open education. We have our OER grant program. We have professional development academies open to all institutions across the state to help build capacity and educate faculty, librarians, instructional designers about OER. We also conduct research on OER efforts and have partnered with Digital Higher Education Consortium of Texas, as well as ISKME, to do an OER landscape survey and look at a regional impact and analysis of OER use across the state. And we develop resources like the one we are talking about today, as well as the OER in Texas playbook. Our division also maintains and works on the statewide repository, which is OER in Texas, and that is a microsite of OER Commons. And so we use that to build our OER community, have resources available, and that was launched in September of 2020 and has currently over 12,000 resources with more than 510 global users in the resource. The coordinating board at large has a couple of other programs that support nursing educators and faculty across the state. And I just want to mention them because it helps build the sort of round out the portfolio of what we're doing to support nurses and nursing educators in the state of Texas in higher education. And so our division of academic and health affairs manages a professional nursing shortage reduction program, as well as a nursing innovation grant program. And then the project that we're talking about today, the OER Nursing Essentials, or we will refer to it as the O.N.E project, is under the direction of the Division of Digital Learning. And what this project is a coordination and a collaboration, a partnership with the Division of Digital Learning at the Coordinating Board and OpenStax. And together we are working to increase access to nursing education by reducing financial barriers and helping to improve workforce development. The project involves design and development of OER for nursing based on the AACN Essentials curriculum. And it involves a lot of collaboration with stakeholders at Texas institutions, as well as nursing educators from across the country. And you'll hear more about that. As Kyla mentioned earlier, the project has gone through several phases, and it has 3 distinct phases that we will talk about: the discovery phase, planning, and implementation. We are currently in that 3rd stage, which is the implementation stage. And the results of that will be the release of 8 openly licensed nursing textbooks published by OpenStax, with the intention to release them in early 2024. And so as we continue the discussion, I just want to talk a little bit about the sort of the origins of the project. It really started with conversations that led to collaboration across the state. The new Essentials curriculum was something that was on top of mind for nursing students, faculty, and educators, and adapting to the curriculum, what course materials needed to be revised, curriculum mapping. And so conversations were happening across the state among institutions with partners like OpenStax, and also hearing from students about the concern of the cost of course materials. And there were conversations happening at the coordinating board because of our support of the nursing shortage and all the other programs that we have. So bringing together all of the partners and the conversations together led to the realization that in order to create OER for nursing at scale, it would take a lot of collaboration, as well as funding and work across multiple institutions and organizations. And that it was important to have student voices involved in the process, but also look at the leadership and expertise of Texas nursing professionals. So the benefits of creating this OER are similar to the benefits of creating OER in many disciplines. But one of the significant benefits was looking at this Texas example. As Anthony said, these resources will be available to anyone and will have a broad perspective, not just a Texas perspective. But if we look at the nursing students alone in Texas, we estimate there are 22,000 nursing students. We use the commonly used estimate of $100 per textbook. We're creating 8 textbooks. By creating these 8 textbooks, we have the potential to save just nursing students in Texas close to $17.6 million in the cost of course materials. So that's a significant benefit. But the opportunity to collaborate with partners and institutions across the state and outside of the state to leverage the existing OER that is available for nursing was also an important benefit. And the benefit of being able to adopt and modify, and which leads to instructional innovation for OER, was also a significant benefit. The project, like I said before, is under the direction of the Digital Learning Division in partnership with OpenStax, and it really builds on other partnerships and previous partnerships that we've had with OpenStax to help grow and sustain open educational resources in Texas. And the coordinating board invested $5.2 million for this project through the Governor's Emergency Education Relief Fund, or GEAR funds, to bring together those expert faculty to develop resources that are competency aligned or aligned with the competency-based curriculum of the AACN Essentials, and also make these resources openly licensed. So I'll talk a little bit more in detail about each of the phases before I turn it over to Anthony, who's going to talk more in depth about the content of the resources, the textbook development, and a little bit about the authoring and peer review process. So we've wrapped up both the discovery and the planning phase. We started kind of at the end of 2021 with the planning phase, really looking at the landscape, the needs, listening to nursing educators and administrators, how the change in the curriculum was going to impact them, benchmarking, looking at budgets, what a project like this would entail. And then that led to a report that produced sort of an outline and a planning document of the resources and textbooks to be developed. Authors were identified, a draft plan for the table of contents, as well as what artwork, illustrations, and instructor resources would need to be created. And we are currently in the implementation phase, which is the most exciting phase, which will result in the actual production of these 8 openly licensed textbooks. To briefly highlight some of the takeaways or discoveries that we were identified in the discovery phase, this phase involved extensive outreach that the coordinating board and OpenStax conducted to nursing program leaders, and that resulted in involvement from nursing educators and leaders across the state from each of the Texas higher education systems with nursing programs. And it involved nursing deans, directors, department chairs. We looked at their detailed perspectives on the emerging requirements in nursing education, student preparation, conversations about teaching during and after the pandemic, as well as the changes to the next generation NCLEX, as well as the essentials curriculum. And a couple of things stood out in that discovery phase, being that nursing, like many students, nursing students also face challenges, barriers to success as a result of navigating complex degree programs, affording their course materials. There was also a lot of collaboration already happening among nursing programs, because of the significant reduction in experienced faculty due to retirements. So many programs were also looking at mitigation strategies and had built strong networks for multi-institutional collaboration. And then the changes in the curriculum, the AACN Essentials curriculum represented challenges, but opportunities to look at how new curriculum and course materials could be developed and what those needed to focus on. And also looking at the next generation NCLEX and how the changes in that also needed to be reflected in the course material and the curriculum for the students. But above all, faculty emphasized that course materials should first teach new foundational ways of thinking and interpreting information. But some of the important pieces of this discovery phase really focus on the collaboration, and that although these resources would provide opportunities for student supports, they would provide embedded teaching pathways for less experienced educators, many faculty and administrators emphasize that creating these would have a profound benefit for nursing education in Texas, as well as support deeper connections between programs and create more collaboration and opportunities to ensure greater success of faculty and students in nursing programs. It also allowed us to look closely at the existing OER in nursing, such as OpenRN and NextGen RN out of Wisconsin, to see what could be leveraged and reused and modified. And lastly, that led into the planning phase. And so the planning phase resulted in that detailed plan that outlined what needed to be in these resources, how they would be organized. It identified the key stakeholders in terms of the authors and the peer reviewers, as well as looking at supporting ancillaries. So through all of that and the identification of what could be reused and the continued partnership and collaboration from advisors and partners, professional organizations in nursing and licensing boards all have had their input. We are very excited to announce that the implementation phase has resulted in the creation of the following 8 openly licensed textbooks. The titles are what are represented on the slide, and they are informed by national nursing guidelines with extensive feedback and peer review. They align with the essentials curriculum. They provide preparation support for students in the next gen NCLEX. They're openly licensed and they'll be available in multiple formats. So I am going to turn it over to Anthony now, who's going to share a little bit more about the content and the resources, and you'll get a sneak peek at what some of these textbooks will look like.
Thank you so much. Thanks so much. So as Carrie mentioned, we took this three-phase approach, and what's on the screen now is the sort of typical, I wouldn't say generic, but a pretty robust process that OpenStax typically undertakes to develop our textbooks. And um, the editorial development is probably the part that takes the longest, that part in the middle, but it really is important to emphasize that the preparation and planning part is very extensive. This typically goes on 3 or 4 months, and it involves a ton of contact with faculty, department heads, leaders, students, advocates, everybody that could be involved in these courses, industry organizations, and student groups, associations, and so on. And so that gives us a lot of that background. You'll see on there things like existing textbook benchmarking. Well, that's just an example of something that's important for instructors to shift from using a commercial textbook to using an open educational resource that we might develop. They'll want to know the differences. They want to know, hopefully there aren't that many differences in terms of what's covered and how it's covered and the features and content that's available. And if there are differences, we'll want to be able to explain those pretty thoroughly. So that's just an example of something we do to help inform the process going forward. The editorial process is a lot like Carrie described. There's this writing and peer reviewing process that essentially cycles through as many times as is needed on a chapter basis. We may do a draft chapter and then do one round of review and find that it's actually that chapter is aligning to what people need and what they're looking for pretty well. So maybe the next round of review would be a little lighter. On the other hand, there are plenty of chapters that take a few extra rounds where there's a topic or a way of teaching or an emerging issue or something in the course. We want to represent people properly. We want to handle the issues using the best evidence-based practice we can, and so on. And also, even with standards like the AACN Essentials, even with test guidance, the NGN and so on, there's interpretations to that. Of course, people, may interpret those standards and guidelines differently in terms of maybe not what the guideline says, but in how they might teach that to their specific audience, that audience ranging from, students at a 2-year college, students at a 4-year college, students in in an advanced accelerated course, RN to BSN, something like that. They might take those a little differently. So we're trying to welcome in all those perspectives in that development process so we can create the best resource possible. Is it possible to get every single thing perfect for everyone? No, it isn't. There's no one textbook, no one resource that can do that. We do the best we can, and then partly that's where the open license can really help. And then in the finalization production phase, we are digging into taking all that content and rendering it into a format that is usable by everyone, in terms of people that need assistive devices, that are going to consume it on their phone, that are going to take it and move. And as soon as we give it to some faculty or some teams or some OER organizations, are going to reconstitute it, translate it, remix it into what they need. That's the goal. If people want to go ahead and do that, and so on. So the way this all comes together, and if we show the next slide, you'll see that these don't exactly align to the discovery, planning, and implementation phase that Carrie just explained, but they loosely align. And in this case, we took what was sort of, I hope this graphic is okay. We, took a whole bunch of different types of information in different forms and different functions coming at us. These advisors, what we were hearing on the standard size, what is happening at courses, a lot of syllabus, course outcome, program outcome, new program development information, what was happening at the colleges, what they're teaching, how they're teaching it, and not even just at colleges, even in certified nursing assistant programs that are taking place in high schools, in some sort of affiliation with the school, and so on. So looking at those and then putting it into a format, Carrie basically went through this, where we're starting to get to the point of structuring this resource, and then moving into implementation, where we're taking all that information and taking the initial outlines and turning that into something that looks, feels like a textbook, can be used in that way, but then again can also be remixed, reused for whatever audience needs it, according to the faculty needs. And in terms of all this input that we're getting is only a microcosm of what we're hearing and seeing and knowing, especially working with nurses, nursing faculty, nursing who are almost all practicing nurses, students and administrators, that the nursing students are almost every time they are considering a situation, a clinical situation, a patient or client need, or so on. They're taking in and considering all these different aspects, and they have to combine all this different knowledge. Maybe not with the same emphasis every single time, but as we progress through each textbook and even the entire nursing curriculum, you notice things that, the unfolding case study in chapter 1 might only address 1 or 2 issues or items. The unfolding case study in chapter 18 is going to have half of them, and the one in chapter 36 is going to have all of them. And there's so much going into every single one, and each of these is its own. I mean, each could be an entire curriculum. Patient communication in light of differences in populations and identities. That's a whole course unto itself. Of course, in a fundamentals of nursing or a med surg course, they're only going to get what they need. So we consider these factors, we consider that, and then we move into what we need to give them. We need to give them, and this is me stating this, just if it's not clear. I'm not a nurse. I'm not a nursing educator. Actually, where we just work with these faculty a lot, and they tell us what we need, and then they develop the resources to fulfill it. This recursive material that's going to keep reinforcing over and over again, thinking about the social determinants, but also recentering the nursing. So understanding that different populations have needs. And really digging into what those needs are, but then recentering the nurse's role in a situation where somebody has a negative risk factor or something like that, over and over and over again, so that we keep building this cumulative understanding among students as they learn. So we progress through these assets. I'll kind of return to this in a second, and I think we can move. Yeah. So how does that exemplify? So this is sort of a deeper look at what that graphic was getting at. We're trying to keep the books moving forward on this recursive. It's not quite spiraling, but there's always recall, what you learned before, how you learned it. The situations and the cases themselves are building on that knowledge. If we created an underpinning that a certain population might have a certain risk factor, that might come forth in chapter 5 or in the early stages of a textbook. But then what we'll try to do is bring that back in a case study later on, recall that in just the conceptual explanation, in a graphic, and so on, so that students are continually recalling that material, bringing it to bear, because we know, especially when we get into the more complex aspects of nursing, and the nursing is the goal, but the certifications like the NCLEX test and so on are sort of how they get there. That's what they're going to be called upon to know, right? To bring that information to bear. We work on all the different considerations of patients and their families. We know, and you'll see that we focus on not just what the care plan is, but the care and the communication plan, the client teaching guideline, considering their family in that is not only for a child or somebody that the dependent of somebody else, but for everybody who might be involved in that care, including other medical professionals or other allied health professionals. There's a lot of features. We know that we want students to read in a straightforward manner, but there's highlights that they need to understand. There's things that you can't read 20, 30,000 words of text just in a block without having something highlighted and something brought out to you. So there's highlights and features there. We'll show some examples of that. And of course, extensive use of case studies. These are important in nursing. We see them a lot. And then art, which we have a lot of art. We'll show some samples of it on the subsequent screens. And so one of the core features is, and this is just an example, there's a few of these core features. These are relatively persistent throughout the series. Some differences, we don't have as many of them in, say, in nutrition as we do in fundamentals, for example. But so the student is going to learn, as they're learning about sublingual nitrates, they're going to learn about the client teaching guideline as well. This is a big role for nurses and other allied health professionals, and they're going to learn about the actual procedure that they need to undertake, or that the client or the family or the caretaker of that client is going to need to undertake. Where there are cultural responsiveness concerns or issues or differences, we'll include those in this context as well. We'll include things like comorbidities or other risk factors as needed, and if there's any side effects to a medication or some other procedure and so on. We can go to the next one. So something else that's pretty persistent across most of the books is the unfolding case study. If you're familiar with the NCLEX and other nursing education materials, you should almost be expecting to see this. These are a big part of how nurses learn, and essentially it's a running case throughout each chapter and sometimes beyond, where the students are getting information as they go, a little bit at a time, just like they would in a clinical situation, in a care situation of, the patient or client is presenting with something changes, you do something happens, and so on. The clinical judgment that is so important to nursing education is coming forth here, and also interpreting what's happening, right? Interpreting vital signs, interpreting responses, interpreting attitudes and adjustments, and then again, interpreting other sort of factors that might be coming in. And then so we'll present the cases, and then we'll have questions about them. There will be some baseline multiple choice type questions like you see here. There's a little more thorough questions and critical thinking and clinical judgment questions that are kind of capture the entire case at once. And again, this is something that the students will see elsewhere in their studies. So we're providing a foundation here. And then of course, faculty will dig deeper, go further in the classroom as well. Some of the other, and we won't go into as much depth on these, but some of the other features that we'll have across our clinical tips, just something, while somebody's reading the conceptual approach to something, learning about what happens actually in a clinical setting. Same thing with the safety alert or FDA black box warning, something they're going to need to know about a medicine they're administering or a procedure they're undertaking, a device they're using, or something like that. And then just some other items like special considerations, just sort of highlighting an issue or a topic that maybe they didn't think of. And then we really try to think about the theoretical side at all times, where this axis of theory and practice that nurses are often undertaking and trying to apply the theoretical model they're learning to the practical situation that they're in. And then if you wanted to learn about some of the other aspects, we know that graphics are very important in learning. The students are going to be using them in sort of like graphic organizer fashion, either replicating on the left here, you'll see a decision tree that a student's going to go through. On the top right, some sort of a basis of a worksheet or a template that they're going to complete. And then just a graphic organizer, this goal 1, 2, 3, 4, 5, as students are going to work through. These are just examples of some of the art that we'd have on this sort of front. And then we also will have art, of course, on the side of anatomical drawings, procedural undertakings, and so on, like you see here. So some of these are repurposed from our OpenStax' other textbooks, but a lot of them are being created new to fit the exact need and highlight the exact issue that's being presented for the nursing situation. And then additional art will come through as well. Something to note that the art is being created to be as accessible as possible. We consider color contrast, other practices that way. It all has alt text, and if there's other types of labels and other metadata that we can put into it, we'll go ahead and do that. Just so that anybody who's reading it using whatever device they need to use it will be able to use it. These obviously are coming across a little small here and things like that because it's on a slide. And then just as an example of how this might come together in the books themselves, it's just you don't have any art in this, but essentially it's going to look and feel like a textbook. The students are going to be presented with learning outcomes, get some information, start to see some of these feature boxes and tables and so on. And that's what the authors and the reviewers are working on, is striking that balance, making sure we're presenting it as thoroughly as needed. And I think that is it for me. Oh, something else, of course, in any discipline, but especially in nursing, updates, things change, information change, evidence changes, some of the standards that we align to change. So we will be doing updates in errata throughout the process. We do updates when we see the need. So if a new set of standards comes out, if something is interpreted differently, and that might not be for all of nursing, right? That might be a nursing organization decides they're going to align to the American Medical Association's disuse of BMI as a standard indicator, right? If they go ahead and do that, we'll go ahead and make a change. It won't be instantaneous. We'll do it when it makes sense, but we'll go ahead and do that. We also take in any feedback and suggestions from faculty, or actually anybody who wants to use them. These aren't wiki books. Every piece that comes in is looked at by a qualified subject matter expert. In this case, it would be a nursing faculty member, or if there is a very specialized knowledge that is needed, something about a certain medicine, a pharmaceutical or a practice or something, we'll have that person available too. But they validate them and then put them out. And then, of course, we have being in working together with the THCCB. You noticed in the chat a little earlier on, we put in the OERTX website. That itself has tons of resources that already exist for nursing and other disciplines. We only expect that to increase. In and around these texts, we welcome and we will actually self-promote, and co-promote other resources, case studies, videos, anything else that's important for this learning of nursing or just learning in general. If any, and then there's one other point, is that not everything can be done here, can be done openly. If people are using a nursing homework system or something like that, lab system, clinical system, VR, whatever, those can still be used, but hopefully, like Carrie mentioned, the offset of the textbook cost will help with the pricing. So this is sort of in summary, taking all the information that we're getting throughout, really thinking about that we're getting a lot of feedback, and that feedback is designed to be to make the material sensitive, to increase belonging, to make it more effective, because in the bottom line, we want to make these resources so that they are used and that the people that use them feel comfortable, confident, and go forward and use them. So we'll always continue with that, and being a part of the open community, it only fosters that sort of growth. We really are indebted to many of the others that are involved in this program overall. Carrie mentioned the O.N.E team has been very helpful to us, and we'll hopefully just continue to cycle and we'll build on them, they'll build on us, others, many others in the organizations, and so on.
Thanks, Anthony. I just want to talk, we have a few more slides to go through, and then I think we can open it up for questions. I've seen some come in the chat, but so what's next? You can all save the date for, we've mentioned that the release of these will be in early 2024. We will be in partnership with OpenStax having a 2-day virtual event with the Nursing Open Education Summit. Registration for that will open soon, but we'll post a link in the chat where you can sign up to receive updates and kind of put that save the date. But we will be, it'll be an opportunity for the community to come together to learn more about these resources, to have some basics on OER for nursing educators, but also look at some adoption and look at how these resources can be used and adopted and possibly modified. So save the date for that. The other option that we will post in the chat, Anthony mentioned earlier, OER in Texas. The first link here, you can join the OER Nursing Essentials or One Project group on OER Texas. It's free to create an account and join the group. The resources, you don't need to create an account to access, but if you do want to contribute to a group or get updates when discussion posts are posted, you can join. But we will be providing project updates there as well. And we've started to curate some of the resources that already exist in OER Texas to support nursing. And then if you're interested, whether you're from Texas or out of Texas, if you're interested in staying up to date from the Division of Digital Learning on some of our community events, you can sign up to join that group and get updates there as well. I think that is it for our presentation. I think we have time for questions. So I guess we can open it up to questions and we can check the chat if there's anything that have come in. You want to post something in chat, or I guess I'll have, if anyone wants to unmute themselves, you should be able to do that as well.
We do have a question in the chat asking if the February summit, for the February summit, if it's the debut of the new texts.
I'll respond there first. I think we can generally consider it that. We will probably have samples and other materials ahead of that, but that's where we'll really be describing them in detail. We'll have the authors, not every single author and contributor, but authors will be there to describe how they took on each within this entire program that we're talking about. There are 8 individual textbooks, and while there are some commonalities among them, there are also differences in the courses, differences in the goals of the course, and even of the textbook. So the authors will be represented there, and then it will also be an opportunity for folks to join and talk about nursing education issues, approaches, benefits, and then and even how to use these textbooks and other OER, and we'll aim to get into things like mapping them to curriculum, talking about how you can customize, incorporate them with other resources, LMSs, and so on. So that's generally what that will be around, and then we'll refine it further. Nice. Just want to say thanks for all these great comments. And I just one thing, if anybody is looking to evaluate, it might be a little early for us to just post a sample today, but we're not. I'll defer to Carrie and Kyle on this. We are having these reviewed by faculty right now, so it's not like we're we're not keeping it a secret. We're just getting them ready. So if anybody really does need to see pieces or learn more about each individual book or something like that, we can certainly provide that.
I think we do have some perhaps sample table of contents we might be able to post in the group. So
I think we have a question about adjusting content for microbiology and immunology.
So we, on the OpenStax side of things, we do have a microbiology textbook now, and there are not that the content is being wholesale repurposed from that book into the. I'm not sure if I'm interpreting the question correctly, but but it is being informed as needed. But in general, for things like where it comes through in pharmacology and so on, that's being developed wholesale new with the microbiology textbook or other anatomy and physiology textbooks as sort of a resource. Essentially, the authors figure out what they need to say and go ahead and write it. And what we'll do is from the other content is maybe bring in things like features, assessments, art, especially, or at least use that art as a basis. In terms of moving back out, what we do in the nursing books and applying them to other disciplines and so on, maybe that's a subsequent phase. But again, being open, if any other resource is usable for that purpose, we certainly can. I mean, one of the things, some of these textbooks not just the open ones, but the the commercial textbooks in something like a pharmacology, they're revised pretty often because of changes in medicine and changes in guidelines, pharmaceuticals, and so on. So we'll have to think about that continuous improvement process. But again, I'm not sure if I'm exactly addressing the question. Oh, I get it. I would say, okay, so I would happen to say, and I'm not here trying to plug the OpenStax microbiology book, but if you haven't looked at it, I mean, it is generally that that nursing facing microbiology, different from, oh, thank you, Carrie, different from a higher level. I forget the titles. I don't think it's like not the Black competitor. It's a different, it's really geared towards that, not necessarily for pre-med students, for example. So it might align, but again, maybe these resources could be combined, to fit that specific need. Of course, it's a very large course for that nursing audience.
And I think so overall, I mean, we sort of started this project with community, and we would like to continue that theme, right? So beginning with our event in February, the idea is really to build these sorts of synchronous events, but also asynchronous spaces through OER Texas and things where we can have conversations about how to use the books in nursing courses, but also in other disciplines, and how can they be adapted for other things. So these sorts of conversations we hope will be ongoing.
Yeah, I think another example of that is it's still unfinished. Of course, we're still working on it, but the community and population health textbook, it has so much information about social determinants of health that really cross into and draw from sociology, social work, counseling, government and politics, civics, that sort of thing, or urban planning even. So much of the material is actually drawn from that. So again, that's another area where it might fit into other courses within the nursing or allied health curriculum, but then even other, like Kyla was saying, other disciplines entirely. Everything's very heavily referenced too, so you'll see it's very academic. You'll see where we're coming from, or where the authors were coming from, and how they put the material together.
Any final questions for our excellent speakers today? Well, if not, thank you so much, Kyla, Carrie, and Anthony. What an amazing presentation. And there's just such great things happening in the state of Texas, which makes me proud because it is my home state. I'm based in Austin. Thanks to everybody for joining us. And I hope that you will stick around for the opening reception. It's going to be happening in about 52 about a half hour, a little over a half hour. Thanks everybody so much for joining us. I'm going to stop the recording now.
Thank you, everyone.